Olivia, Michael, thank you very much for joining me to talk a little bit about the exciting news that the vaccination is in our horizon. We're excited. This is a big part of our toolkit of dealing with the risk of this pandemic. So thank you for being a part of the conversation this morning. I want to say to our staff specifically, thank you very much for the tremendous work and the response to the pandemic and the managing of the risks that we have been going through for the last almost a year. And in addition to that, I want to acknowledge that it's not over. We have big work still ahead to do to manage our protocols, to adhere to the strict procedures that we have. And I'm proud and thankful that you have taken it seriously as individuals, as Calgarians, to be safe and to manage those protocols in your own life, but also to adhere to Silvera's very strict protocols. Now that the vaccination is in our horizon, it's a big step towards the solution and reducing the stress that we're all living in through the pandemic. And it's a critical component to our efforts to continue to manage through the pandemic. So I want to encourage you all to take the vaccination. I know I sure will. And I would invite you also to invite others and encourage others to take the vaccination. We're an essential service, and it's really a big part of our being a part of the solution. So line up when it's available and make sure that you participate. Olivia, I'm going to invite you to just talk to our staff about the efficacy, the safety of the vaccination, given your insight and your background with Alberta Health Services, if you wouldn't mind.
Since the beginning of this pandemic, our residents, our staff, our colleagues, along with all the other Calgarians, have endured a lot of restrictions, social isolation measures, which all taken a toll on mental health. Having this vaccine be part of our solution is a critical point. Even though the vaccine has been developed in the last 9 months, it's been rooted in years and decades of research of vaccine safety. And we have to take advantage of this opportunity to protect each other. As the world is rolling up their sleeves and getting immunized, we are noticing that the vaccine is safe and is effective. And I encourage everyone, residents, staff, colleagues, Calgarians, to roll up their sleeves, save lives, and immunize.
Thanks, Olivia. Michael, would you mind speaking to the staff about our immunization and what they can expect with regards to the vaccination coming online?
I'm also really delighted and grateful that the vaccine is now available to our staff. We've told our staff that they are an essential service, and it's essential to me that our staff are well, and their families too. Silvera has decided that the vaccine will not be mandated for staff, but we are strongly encouraging them, based on the scientific evidence of its safety, to get vaccinated. And our staff are really used to vaccines. We have a strong immunization campaign every year, and our staff they show strong pickup of that and getting vaccinated. If staff choose, though, not to get vaccinated with the COVID vaccine, they may be restricted in terms of not being able to pick up shifts, especially in facilities that are in outbreak. So I know that we shared staff contact information with Alberta Health Services in anticipation of the vaccine being available to them. And there may be some delays, but we're optimistic that that will occur shortly. So sort of stay tuned. We'll let staff know as soon as the clinics are being set up and Alberta Health starts vaccinating staff.
Thank you, Olivia and Michael. It's really an important and exciting time right now as the vaccination becomes available, that we tell our staff that we hope that they will participate in the vaccine program. It has been grounded in research, as you say, and it's an important part of the solution. It's not the only solution. It is really important that we continue to follow the protocols, wear the PPE. The vaccinations have started to roll out in some of our communities, but we'll be patient as they become available to complete all of our communities for all of the residents. And for you as our staff team, you're an essential worker and our work is essential. And as Michael has said, it's critical that you are healthy too. So participate in the vaccine program. We are encouraging you and we're asking you to encourage others.